Carl, thanks. From time to time, we have told you about government efforts into health care and how they compare with the current reform plans being debated here in Washington. Tonight, a cautionary tale from Tennessee. Correspondent Jonathan Serry reports from Nashville.
With debate raging around the country over a public option for national health insurance, critics are drawing parallels to a state program in Tennessee.
I think it's identical twin.
Republican Congressman Phil Rowe worked as a physician under TennCare, an ambitious public program to cover the poor and uninsured.
It was a noble goal, there's no doubt about that. But the problem with it is it didn't work.
In the program's first year, Tennessee saw a dramatic reduction in the number of uninsured residents. That cut down on the number of non-paying patients using hospital ERs for routine treatments. This TennCare scholar says early on, the program saved money.
It's in the eye of the beholder. It was kind of everything to everybody. You could cut costs and expand access to care.
But TennCare enrollment quickly ballooned. The lure of inexpensive coverage provided by the government proved irresistible even to many who already had insurance.
45% of the people who ended up with TennCare benefits had private health insurance but dropped it.
And some uninsured Tennesseans sought coverage only after they got sick.
This basically became easy for the insurance companies to deny coverage with knowing that the government was there as the insurer of last resort, and it became a very expensive program for the state.
During the first 10 years of the program, TennCare's budget swelled from just over $2.5 billion to $8.5 billion. Faced with a serious budget crisis, the state scaled back TennCare in 2005. More than 150,000 non-Medicaid patients were dropped from TennCare to shore up the budget.
It was too generous a package, too easy to get onto the rolls, not managed, and that's when Governor Bredesen came on the scene and said he had to, as they say, they bend the curve.
While TennCare was the only safety net for uninsured Tennesseans, some proposals in Washington would offer Americans a choice between public and private plans. Despite the differences, supporters and opponents of health care reform look to TennCare as an example of what could happen on a national level. In Nashville, Tennessee, Jonathan Serry, Fox News.
Well, the federal government is now saying 1 in 5